Stevenson runs 28 minutes from the Veterans Memorial Tollway to Lakeshore Drive, outbound 22 minutes. Bryan, 20 minutes, 95th to downtown. I-57, 11 minutes. I-80 to the Verge, Bishop Ford, 11. Northbound Lakeshore Drive is 7. 18th Drive to Roosevelt. I'm Jim Talamonte on AM 560, The Answer.
Jim, thank you. Chicago's Morning Answer continues next. AM 560 Weather Center forecast with our AccuWeather meteorologist, Steve Williams.
A freeze warning for early this morning. Clouds and a shower today, mixed with some snow early. Look for a high of 45. Partly cloudy, cold tonight, a freeze warning, low 31. And then sunny tomorrow, the high 56. Plan with confidence this spring. Download the AccuWeather app today. I'm Steve Williams on AM 560, The Answer.
33 at O'Hare. Next news at 7:30. And remember that freeze warning this morning. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
From the Matrix Home Solutions studios, this is Chicago's Morning Answer on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, on your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. This is Chicago's Morning Answer with Dan Proft and Amy Jacobson on AM 560, The Answer.
Good morning, Dan and Amy. This is a fun story from the UK. Fun COVID story. You don't get to say that much.
Oh, a fun one? Is this positive news? Because Americans only, 90% negative news, Dan.
That's right.
According to a Dartmouth study.
I guess this is positive news depending on your perspective. And from my perspective, it's very positive.
What?
On the positive news that I think is incontrovertible, the UK now has vaccinated at least one dose, 90% of its 70-year-old plus population.
Oh, that's wonderful.
Deaths there have dropped from 1,000 per day in February to about 25 per day now. And one pub owner, a loyal Labor voter, so leftist, or more leftist than, whatever constitutes a conservative in England, Rod Humphreys is a bit fed up. Outdoor seating at pubs has opened, but much of society still restricted, and he's not happy about it. He's the landlord of the Raven in Bath, and he clashed with his party's leader, Keir Starmer, when he showed up for a little photo op. He waved a graph at Starmer. Said, "Do you know what the average age of death with COVID is? According to the Office for National Statistics, it's 82 years and 3 months. The average age of death normally, 81 years. He went on to say, "You have failed me. I have been a Labor voter my entire life. You have failed to ask whether lockdown was functioning. Do you understand? Thousands of people have died because you failed to do your job and ask the real questions." Starmer replied that hospitals were overwhelmed. They've been on the front line keeping people alive, so I really don't need lectures from you about this pandemic. Thank you. Shall we go in? Well, at this point, the pub owner, Humphreys, was not content with that response. He walked into my pub without asking, and I threw him out. Or at least I did my best to throw him out. His security got in the way. And Starmer, the Labor leader, finally left after his security guards manhandled Humphreys, the pub owner. But he's not finished trashing Starmer. Good for him. He told the Daily Mail, he has completely failed to ask questions that needed asking, like, why did we throw away our previous pandemic preparedness? Why have we just accepted lockdown? Why have we just accepted the loss of all of our freedoms? Let that be a lesson to all you pub owners in America, starting in Chicago, maybe. Thank you, Rod Humphreys, for the courage to go after the charlatans in your neck of the woods. We appreciate it. For more on the charlatanry around COVID, pleased to be joined again by Dr. Chad Savage, founder of YourChoice Direct Care and policy advisor for the Heartland Institute. Dr. Savage, thanks for joining us again. Appreciate it.
Happy to be on.
Yeah. And by the way, feel free to lead the medical community in accosting politicians rhetorically too, if you'd like, Dr. Savage. Would not offend us.
Yeah, the sad truth is the last year has really created a grand cynicism in me and the infallibility of my profession. You know, I had this maybe naive assumption that science and the practice of medicine was above the interference of petty politics, but sadly the last year has been quite illuminating on that regard.
Indeed, and you've written a couple pieces recently about COVID vaccines and COVID testing, specifically with respect to children. COVID vaccines for kids. I mean, everybody should get vaccinated just as quickly as possible. There should be vaccine passports, like the LA school system is setting up for daily testing, and and vaccinate and proof of vaccination, and so on and so forth, out of an abundance of caution, right?
Yeah, well, I mean, that's kind of the common narrative, and if you try to say anything contrary to that, Facebook will shut you down. And the specific issue that I was writing about in a piece in Town Hall was there's a big push right now to get what's called emergency use authorization, which is the same process they got to get the current vaccines available to adults, but now to get it for children. And you know, the thought would be, well, kids can get sick, they can be vectors of infection, meaning they can spread it. Maybe if we get them the vaccine, that would decrease the spread to the truly vulnerable elderly people. But the problem with that is, you know, these children are at immensely low risk of becoming seriously ill or dying. So if you are trying to take a near zero risk and reduce it further with a vaccine, you better make darn well sure that the thing that you're injecting into them is incredibly safe, because they're actually likely to derive minimal, if any, benefit from that vaccination. So before we start giving this to millions and millions of people, we probably should tap the brake. You know, this is not a group that is at immense immediate risk. The elderly were. I mean, back when this was approved in December and the studies came out in November, you know, we just got through a big surge of cases in November. So there's a real push to try to get this out as quickly as possible to the elderly. So they used the extraordinary measure of doing the emergency use authorization. Well, now they're trying to use the same process as though there's currently a pandemic level of death in the children, which is just actually not true. I mean, sure, you're going to get individual cases of people who have died from COVID, as you will from just about any disease, but they are absolutely not dying en masse. And we better make darn well sure that any vaccine we give them is incredibly safe before we subject an entire generation of children to it, which it may very well prove to be. But we should tap the brakes. It's, take a breath, and look at it reasonably.
Well, the only one we can give our kids right now, 16 and older, is the Pfizer vaccine. And I've got an appointment this Sunday driving to Gary, Indiana to get both of my boys vaccinated. They're ages 16 and 17. Should I not do that?
Well, it's a personal choice, but you need to know, what's their inherent risk. Are you really doing it for them? Are you doing it for other reasons, like is a school requiring it? And if you decide, I am worried about this and I want to do that, that's fine. It needs to be a personal liberty thing. But the reason they're trying to use the EUA, the emergency use authorization, is because they're trying to get it approved before school of next year. Now, if they do that, and that's the end goal, do you think that's so people can have a voluntary administration of the vaccine? No, it'll likely be used as a requirement for attending.
Oh, yeah, and that's why I'm doing it, because somebody in their pod or somebody on their team is eventually going to get a cold that they won't even know that they have it, because somebody healthy will some parent will make their healthy child get tested, and they'll come back, maybe a false positive. But I'm doing it so that once they're both vaccinated, they don't have to sit out the 14 days or the 10 days.
Exactly. So, and a lot of people are doing it for that reason. And the real reason to get a vaccine should be you're trying to protect against an infection, not protect against some bureaucratic dictate.
And that exactly perfect.
The Eva Perone of East Lansing, in her infinite wisdom, Gretchen Whitmer, she of the mandating that public-facing businesses hire a COVID safety coordinator to monitor COVID safety protocols in businesses. Also requiring all athletes aged 13 to 19 participating in school and recreational sports to undergo nasal antigen testing at least weekly. Now, that cohort, 13 to 19, has about the same chance of dying from COVID as they do of dying in a car accident, as I understand it.
Actually,
they have a better chance of dying in a car accident. That's the leading cause of death.
To a bicycle.
But a bicycle accident. Okay, even better. Fair enough. So what about this testing though? could you argue that well, that's just it's like the bicycle, and it would just be like all we're doing is saying wear a helmet when you ride your bicycle because it will reduce the chance of fatality that much more. That's what the testing does.
And I can appreciate trying to have risk mitigation, even for a low risk, like dying in a bicycle accident. But is there, there's any intervention you do has a potential unintended consequence, and testing broadly does too. This is why, for example, we don't do prostate specific antigen PSA testing in 20-year-olds. Yes, I guess you could theoretically find a 20-year-old, the incredibly rare 20-year-old who has prostate cancer, but you're going to have the test come back falsely positive in tens of thousands and subject them to prostate cancer's biopsy or prostate surgery and biopsies and other adverse health outcomes. And the same thing can occur with this too. So if you're talking children who are at incredibly low risk of becoming severely sick and actually do not spread the COVID infection anywhere near as much as elderly people, why are you subjecting them to the most scrutiny? If the truth is, if you were trying to intervene in an athletic competition that was most likely to have a meaningful impact on its participants from spreading COVID, you wouldn't be looking at high school softball. You would be looking at the geriatric pickleball.
Right.
Don't start messing with pickleball. That's going to be my sport of choice pretty soon, I believe.
And is there
the way I'm playing golf.
any recorded case anywhere of student to teacher, student to coach transmission of COVID?
I wouldn't go so far as to say there's absolutely not an individual case. There probably are some, but the vast majority of the transmission occurs, if it occurs at all, from teacher to child, not child to teacher. So again, why do this kind of testing? Is there a downside of doing it? A test, it's just benign. It's a little swab in the nose. Well, first of all, who's doing the testing? There actually have videos in the state of Michigan trying to instruct school secretaries as to how to do the COVID testing, which is interesting because they can't even administer Tylenol without an approval from the parent. Right. But now they're going to do an invasive nasal swab, which again isn't the end of the world, but there have been some people who've been injured by them. What about the secretary themselves? Now, are they going to be exposed to the risk, having hundreds of student athletes multiple times per week tromp through their office getting tested? There's an exposure to them. They need the personal protective equipment, the PPE. Could the congregating of all these people for testing itself be a spreader event? And then there's the risk of what's called false positives. So there was at least one study that looked at the type of tests that they're using that indicated, and this is some of the most pessimistic numbers, that it would only pick up about a third of asymptomatic people, people who are not sick, they feel fine, which is who they're testing. I mean, you don't have to test someone who's symptomatic to tell them to stay home. You can just say, oh, you're sick, stay home.
Right.
Don't, whether it's COVID or rhinovirus or some other infection, don't come to school, don't come to practice if you're ill. You're just going to expose other people. So the reason they're doing this is to detect those people who have no symptoms and try to get them to stay home, which kind of makes conceptual sense. But if you're going to only pick up 1 in 3 of them anyway, it's missing a large aspect of its potential benefit. And though a small number of cases of false positive, which means the person is actually healthy, but they're incorrectly told that they have the infection, does disrupt their lives. One of the estimates in asymptomatic people is that it's about 1%. So 1 in 100, that doesn't sound like very many, will be told they have COVID when they're actually healthy. But the spring sport athletes in the state of Michigan is about 150,000, so that means 1,500 children every single week or every time they test, which could be up to 3 times a week, will be told that they are positive when in fact they are not, and they'll have to quarantine and have to go follow-up testing, and their primary contacts, like their family members, will have to stay home from work, or siblings from school, even classmates may have to. So there's a real domino effect there as to the adverse consequences of a program like that, which has real nebulous benefit. If it had a benefit, we've been doing this now for several weeks in the state of Michigan. We're leading the nation right now in cases. So we have the most lockdowns. We like you're talking about the businesses being required to have a COVID safety person and such. Well, if these things were so incredibly effectual, why are our numbers in the state of Michigan far worse than anyone else right now, where places like Texas, which are almost fully open, actually, since they've opened, have had decreasing case numbers? And people like Fauci, can't explain that. and
Like,
kind
what
of
about your
have all-
hospitalizations?
Well, but before we get to that, I guess the Motor City Madman, Ted Nugent, won't be invited to do a high school campus tour in Michigan. But I wanted to get to something you just referenced with respect to this antigen testing. The Binax Now rapid antigen test, which is being used, has a 64% likelihood of missing the presence of the virus. So, as you just said, 1 in 3. Well, it will miss 2 in 3. So only 1 in 3 will be caught. So isn't this so much COVID safety theater?
Yeah, so there are several different rapid antigen tests, and that's the one that they're primarily using in the state of Michigan. And that number is specific in one study that looked at testing asymptomatic patients. If someone is symptomatic and they used it, the positive predictive value, the chance that if it comes back positive you're really sick, is actually quite a bit higher. But in asymptomatic patients, it's not that good. It's actually the home test. That the Bionics Now is actually a home test, and the ID Now, which is their medical office test, is showing in some studies to actually be less efficacious than the home test, which makes me question the numbers altogether. I just have trouble believing that the one that has a specific development device that we're paying a lot more money for in the medical offices is less good than the home test. So the numbers are kind of sketchy, but even if they're to be believed as they are, there's quite a bit of downside when you're talking about testing hundreds of thousands of people.
I wanted to ask you about, I know that your cases are up. I know. Is your positivity rate still at 16 plus?
I don't know the current number on that. I do believe that we are plateauing in the state of Michigan. For the first time in a while, my local hospital actually is starting to tick down on their inpatients, but we're talking literally in the last few days. There are quite a few cases out our way. It's absolutely present here,
right.
And again, it's somewhat inexplicable when you look at the rest of the nation as the cases continue to tick down, and yet one of the most locked down states continues to go up and have a real problem.
But you have plenty of. What's hospitalization and ICU capacity? Are you?
Yeah, that's the real concern, right? It's interesting. World Health Organization, when we talk about lockdowns, they're still being propagated and pushed in many parts of kind of what we can do for non-pharmacologic interventions, non-drug interventions for the infection. But even the World Health Organization, which is not exactly a right-wing organization, last year said that the lockdown should be used as an absolute last resort only to prevent oversaturation of the hospitals. And the problem is states like my own have been doing them for an extended period of time in the absence of any threat like that. And the question is could they actually conceivably contribute to the spread? Andrew Cuomo, even in the early stages of the pandemic, announced that his surprise that many of the infections that were spreading in New York City when it was so bad were occurring in people who were in fact staying home, and that this was kind of inexplicable. So there's a lot that we still don't know. Is it possible that by forcing people to stay in confined, closed spaces with other people, we know that duration of exposure to them increases the chance of spread? So is it actually possible lockdowns could actually worsen the spread? And that we just don't know. But the hospitals definitely in the state of Michigan have a problem right now, and the hope is that the observation that we appear to be trending down now hopefully is correct, and hopefully we'll start freeing up beds and getting back to normal. When you look at the infection rates, it's very much a sine wave, and it seems to be independent of our interventions. Whatever we do, locking down, masking, all these other things seems to, when you look at one state to the next, one state's open and one state's closed, there seems to be very little difference in its impact of the transmission of the virus. And a sine wave is just literally up and down and up and down and up and down. And that's exactly, we see that. And the good news is about the current one is though the cases are high and the hospitalizations were high, the death rate, at least in the state of Michigan so far, has not come even close to what it was prior to the vaccine. So even though people are getting sick, even though people are getting hospitalized, it tends to be younger people right now. So this would support that in the elderly, the vaccine probably is a good idea. It's younger people who are largely surviving this.
Right.
Who seem, and by younger I mean people middle age, so like myself. So I'm not talking children.
Well, right, and I mean the mortality rate among people under the age of 40 is trending toward like 1/100%, and so that combined with what you were just describing in Michigan, why have we lost our interest in therapeutics as part of this conversation and treatments for those people that get infected?
Yeah, I don't know, and I mean there seems to be a real push for preventing assessments of drugs that can be repurposed, meaning that they're out there for a different reason, but they may also work for this. I don't know for sure that ivermectin and drugs like that actually work. It's interesting and should be looked into. I'm at least open to the concept. People should be open to the concept and look into it. But it seems that there's a lack of openness to even consider repurposing existing drugs for therapeutics. There are the monoclonal antibodies, which are being encouraged, and those, like the Regeneron ones, like President Trump received one in October when he became ill, which seemed to work really well anecdotally in his case. But those aren't easy to get. They're IV infusions. They're talking about having EMS come out to the house and infuse them. Well, okay, that's great. Well, you've got an hour-long infusion, in which case you have to do vitals the whole time. And now the EMS gets a call for a car crash. Well, who's going to respond to that car crash when we've got EMS occupied with administering monoclonal antibodies in people's homes with IVs? So that, even though that's an encouraging therapy, probably a better distribution needs to be determined than occupying our emergency services with administering them.
He is Dr. Chad Savage, founder of YourChoice Direct Care, policy advisor for the Heartland Institute. Dr. Savage, thanks for joining us again. Appreciate it.
Thanks so much.
Yeah, always a pleasure. And he joined us on our turnkey.pro answer line.
If you're talking about it, Dan and Amy are talking about it. It's Chicago's Morning Answer on AM 560. The Answer.
What do you think is going to happen to our tax rates over the next few years? We all know the answer to that. Congress is going to have to pay for all the stimulus spending, trillions of dollars worth. So what could that mean for you? Higher taxes. Now is the time to protect 401k, IRA, and other investment accounts from future tax hikes. Tom Fortino and the team at the Alpha Wealth Group can help you do that. Tom can show you how forward tax planning can potentially save you money. How can someone give you investment advice without actually understanding the tax implications on that advice? If you're